Hi, I'm Jerry Hesch, an orthopedic manual physical therapist, which means I treat joints. And I work at Hesch Institute in Aurora, Colorado. And this is a very, very unique sacroiliac presentation. She suffered 2 traumatic events. And what we find on her pelvis is hypermobility of each hemipelvis or ilium and hypomobility of the sacrum. So we'll come to a close-up and I'll demonstrate the spring test. I have multiple other YouTube videos that demonstrate what I name spring tests or spring recoil. And I'll first demonstrate on the thigh. I can push down through the thigh and it takes up the slack in the soft tissue structures surrounding the knee joint. And now when I do an additional amount of force, then that should fairly isolate the knee joint. So this is the spring, and it's a forward thrust, and you'll notice there's a bounce back. So I take up the slack where movement stops, and then I do a thrust, and the structure is strong, it bounces back. In her pelvis, she does not have the backward bounce. When I thrust it, it just goes forward a little bit and it just stays there. Very unusual. So I'm doing a posterior rotation spring test and I push with about 15 pounds of force and I take up the slack. Now it stops. So now I'm going to do another thrust. Here comes. And there's just no bounce back. It just moves further that way. And that's the same thing on this side. I take up the slack to a natural stop and then I thrust it and it just moves a little bit more, but it doesn't bounce back. Lie on your stomach. This is an extremely unusual behavior and I call it hypermobility. And I believe there's an explanation which we'll get to. So now I'm doing a superior glide spring and you can see her head move when I do that. So look at her head. You can see her whole body moves when I take up the slack. And now I thrust it and it just thrusts a little further, but it doesn't bounce back. And that's true in multiple directions. And now I'm springing on the ischia and I push. I take up the slack and spring. It just moves forward a little bit more. And I'm rotating the left ilium forward, take up the slack, spring it, and it just goes further but doesn't bounce back, okay? When we come to the sacrum, I notice that the sulcus is pretty deep, okay? So what, it behaves as though the sacrum is forward into her body. When I try to spring the sacrum on the midline at the upper 3 sacral levels, S1, S2, S3, there's no movement. Now I'm at the top of S1, trying to do forward bending of the sacrum, no movement. I'm on the bottom of the sacrum at about S4, 5. There's no ability to take up the slack, okay? And I'm trying to glide sacrum inferiorly, there's no movement there. Another telling thing is that the sacrotuberous is really loose. I'm having a hard time defining the sacrotuberous ligament, but it should be right here, and I can push it, and there's no bounce. There's no spring in that ligament. That is ligament laxity. What I'm suggesting is that she has a very unusual, very rare injury in which the 2 traumas caused sacrum to glide into the body, and realize the sacrum tapers it tapers outward, so it does have the ability to move forward, and then the ilia would close on it and keep it forward. So I believe that the sacrum is stuck in anterior glide into the body, and then each half of the pelvis came posteromedially. It's called an outflare, and maintain that. So what I'm going to do is place foam under each ilium, making sure I'm not on the sacrum. So I'm going to be on the ilium and on the ischium. Create a V using 2 of these. She'll lie on her back, and that should glide the ilia outward essentially catching up with the sacrum, or at least gapping the SI joint slightly and allowing that sacrum to come back into posterior glide. Let's have you lie on your back. So some people would say, oh, you need a fusion of your sacroiliac joint because you're hypermobile. Let me put this underneath you. To which I say, no, let's try my method of restoring mobility where it's lost.
Right.
And see if that restores normal ligament tone. Okay?
Okay.
I want to do one more spring test. If you would lie on your stomach one more time. So I'm on the PSIS. So I'm on the posterior ilium, just lateral to the SI joint. And I'm trying to do an anterolateral spring test. There's no mobility at all. And this is a very important spring test, and we'll retest this after we treat you. And here it is on this side. Okay? So let's have you lie on your back. It's such a rare injury, extremely rare. I can't contain my enthusiasm, coupled with my optimism that we'll be able to help
I
you.
like that part.
Okay? So we're going to place this, making sure we're not on the sacrum. It's under the ilium on both sides. It's in a V pattern, so it also catches the ischium. So on the pelvic model, it's like this on each side. Okay? Now, I don't know if it matters if your legs are straight or if they're bent. You're okay with them straight?
Mm-hmm.
Okay. So we'll leave it like this.
Okay.
I'm going to set a timer for 5 minutes.
Okay.
After that, we'll come back and we'll reevaluate you. And the last time I had one of these was about 4 years ago.
Really?
And the patient responded very well to this treatment. She was a horseback rider.
Oh.
Yeah. Okay, so we'll come back in 5 minutes and see the response.